Our speaker, Dr. Karen I can't say it properly, I'm so sorry. Faisandier. Terrible, sorry, has set up a practice in Wellington. I think you set it up in 2016, and she's taken a truly integrated service and looking at all aspects of people's lives. So it's really great to have her speaking to us today. And the topic of the presentation will be Out of the Fog, Celiac Disease, Your Brain, Food, Mood and Mental Health Concerns like anxiety, depression affects half of the population. So there you go, to prove my own point. So I think a lot of us have all been, can I just actually say, show of hands, who in the room's been glutened in the last 12 months? Yeah, I have to. Yep. And what's it like going out to a restaurant after that? I know exactly what you feel like. Or one of the board members, Max, was telling me about a time he was gluten just before he did a really big work presentation. You know what I mean? You know, some of us can't even go to work without worrying that we're not going to be able to do it. And that really is a tough thing to deal with. But we're lucky to hear from Karen today, and she's going to help us to address it and answer some of the questions you might have through your slide app. So thank you, Karen.
Kia ora koutou. I'm Karen, thank you for that introduction, and thank you very much to Celiac New Zealand for inviting me along. I was delighted to be asked to speak on a topic I'm very, very passionate about, which is nutrition and mental health quite generally. When I trained as a clinical psychologist, I didn't get that much on nutrition or gut health, and it was quite separate. Although we trained in a biopsychosocial model, we just simply didn't really cover it. With a few exceptions such as around eating disorders involving dietitians, iron is a relevant deficiency for women, vitamin D deficiency for seasonal depression, and I think that's it. But I went on to discover that nutrition is foundational for our physical and our mental health. And while it can't solve all mental health problems, of course, many symptoms like stress, anxiety, fatigue, sleep disturbance, emotional dysregulation, and even depression can resolve or lessen when you get nutrition right. And celiac disease is one of the many autoimmune conditions that I've worked with over the years, but I wouldn't say I'm a celiac expert. So it is one of the conditions, though, that has an even greater need for focusing on nutrition, especially if there are mental health concerns and symptoms. So I'm going to be talking about getting out of the fog and how we can do that through various ideas from both nutrition but also some psychology kind of interventions for that. I have 3 disclaimers before I start, and I've written them down so I don't forget any because they're important. The first is that I'm not a trained nutritionist or dietitian, and I'm not medically trained. But after university, I did train in postgraduate papers in an area called Nutritional and Environmental Medicine at a place called ACNEM in Australia. And my ongoing professional development is all on this area of integrating nutrition, lifestyle with traditional psychology kind of interventions. And in my work, I work very closely with other health professionals and nutrition experts for clients with complex needs in Wellington. But my scope of practice is mental health. And this talk focuses on nutrition to support mental health when you have celiac disease and when you follow a gluten-free diet. What I'm going to present is based on the literature on nutrition and mental health and the nutritional issues caused by celiac disease and gaps on that celiac gluten-free diet. And where possible, I'll provide resources that you can follow up. But my second disclaimer is that information in this talk shouldn't be treated as personal medical advice, and I always recommend that you look into the resources, that you talk to your health professionals before you try anything. Nutritional interventions for mental health are generally very safe, but there are some exceptions where where it may not be, and it is possible to take too much of certain nutrients. And lastly, I don't work with people under 18, so while most of what I'm going to talk about is particularly important for anyone across the whole lifespan, and as we heard about earlier today, for young people where their brains are growing and developing, perhaps even more so, I just don't have expertise in that area. I have an adult focus, as that's the population that I work with. So, that all out of the way, let's get on with some things. And I've got a lot to get through in 40 minutes. So, I don't have to tell you that we have a growing mental health problem, not just in New Zealand, but all around the world. And in 2018, the government did an inquiry and found that 50 to 80% of Kiwis would experience mental health problems or addiction problems in their lifetime. And what we find is that in spite of more treatments being available, more people aren't getting well because we have a shortage. There's a treatment gap between access to the two main treatments, which is medication and mental health therapies with psychologists and counsellors and psychiatry. And those with celiac disease or other autoimmune conditions may have even greater risk or be even more prone to these sorts of mental health symptoms. And there's a lot of multi-directional interactions that go on that are involved via the gut-brain axis and the vagus nerve, which I'm going to come to shortly. And chronic stress and trauma in somebody's life, whether that's through childhood or youth and adulthood, can be a switch where things turn on. So those with celiac disease in the literature, there's a lot of mental health and neurological symptoms that may occur in celiac disease, even in the absence of any noticeable gut symptoms. And these can range from anxiety and depression, eating disorders, chronic fatigue, a foggy brain, neurodiversity, ADHD, and there is even case reports of mania and psychosis. And why is this? As I've mentioned, it's this multi-directional interaction that's going on between the microbiota, the commensal bacteria that house in the gut, the immune system, and inflammatory processes that can cross through the gut, both the gut and the brain's barriers, and cause problems for people. In addition to that, there can be gluten-induced malabsorption, which is well known as a symptom of celiac disease, and many nutrients of these many nutrients in food, so folic acid, vitamin B6, B12, iron, zinc, and vitamin D. In addition, there can be a dysbiotic gut, so where things have got out of balance with the bacteria that are housed there through things like antibiotic use, stress, a couple of very common contributors to that, as well as dietary gaps that may exist when following a Western gluten-free diet. And as Sam mentioned earlier, the threat of being in that gluten-dominant world. So I think of it as constantly having to analyse, am I safe, can I eat this? And that kind of hypervigilance that comes with that. And because sharing food is such a big part of how we connect and celebrate and socialise. And of course, there's the individual context, all the ways that we individually think, feel, about having a diagnosis like celiac disease and the need to avoid gluten. So I thought I'd put a picture just to try and capture what is this gut microbiota axis, and I wasn't sure if anyone here has kind of seen something like this before, but this is a picture taken from an article I read recently that shows the difference between a healthy microbiome and a dysbiotic microbiome, and it tries to explain kind of this really complicated interaction in terms of a leaky gut and then therefore a leaky brain where things can make their way where they're not supposed to across the blood-brain barrier, which we thought wasn't possible up until not that long ago, but now we know that things can make their way. And when you have a leaky gut, there generally is leaky brain. And a lot of processes go on. We have the vagus nerve, this nerve here, which innervates to all of your organs and is constantly signalling between the gut and the brain and incoming information from your environment, stressors, traumas, but also just whatever's in your environment, communicating all the time. So some of the psychological manifestations of celiac disease, as Alessandra Fasano calls it, it can be a clinical chameleon. So it can present psychologically and neurologically. So some of the increased, or the things that may be at increased risk from mental health perspective, are found to be anxiety and depression, neurodiversity potentially. There's an increased risk found. Those with celiac disease are overrepresented in the ADHD population. There's an increased risk for eating disorders. There's many neurological symptoms that may occur, such as peripheral neuropathy, which is numbness and tingling in the extremities. People may experience seizures, migraine, the foggy brain, and there's mixed findings as to why. So antibody cross-reaction is one, immune-related is another, the potential for neurotoxicity, and one which I'm going to be talking more about today, nutritional deficiency. And an example of that I see often, which is B12 deficiency, which can cause things like that peripheral neuropathy, as well as anxieties, disorders, and panic attacks and things like this. But there's more research needed, really. It's quite a complicated picture as to these relationships. I would say that brain fog is one of the most debilitating symptoms or aspects of an autoimmune condition, and it's not unique to celiac disease, but I believe that it's been found to be present in pretty much anyone that has celiac disease. And it can come and go, and it is that sense of feeling like you can't rely on your brain, that you're not yourself, and there's these transient cognitive impairments going on to your memory, being able to recall names, paying attention, executive functions, being able to make decisions and do that in a timely way. And according to this article I've cited here, the most likely cause is systemic inflammation or cytokines. So thinking about the picture that I showed earlier, how inflammation makes its way through the body, through these cytokines that flood around, which in celiac disease would be triggered by gluten exposure, and that causes inflammation in the brain. And what's important to note is that it's not only caused by gluten. So everyone here knows already that lifelong adherence to a gluten-free diet is required if you have celiac disease. But often gluten-free alone doesn't go far enough for good mental health. So how come? I found this quote here that this marked increase in gluten-free substitutes allows celiac disease patients to reproduce the dietary habits and patterns of the general population. But I ask whether this is such a good thing, given that a lot of research finds that much of the general population is now eating mostly ultra-processed foods, not meeting their dietary needs, and are neither physically well or psychologically thriving. And often the gluten-free equivalents can be less nutritionally nourishing than the non-gluten-free equivalents. So according to Professor Julia Ruckledge, who I'll come back to as I go through my talk, she's a food and mood researcher and author of the Better Brain book, which is a great book all about nutrition for mental health. According to her, the brain is the most hungry organ. It's only 2% of our body weight, but it's 20 to 40% of our energy needs. And nutrients are involved in all sorts of functions in our mental health. So micronutrients found in food support things like your nerve conduction and being able to help your genes express. They support mitochondrial health, where we make energy and ATP. Micronutrients can support being anti-inflammatory and help detox from pollutants in the environment. And they, importantly, are the ingredients that are used to make neurotransmitters, which are your brain's chemical messages that are implicated in things like depression and anxiety. So things you might have heard of like serotonin, dopamine, GABA. It's the food that we eat that literally helps us to make that. And when we're eating more ultra-processed foods, these are quite new to our diet. Our brain may not recognise some of the ingredients. They may be lacking, or they are lacking in certain nutrients. And they can contribute to this balance of inflammation in the body. So we used to have an omega-6 to 3 ratio that was about 1:1 or 2:1. And these days, what it looks like is that it's potentially 15:1 or even higher. and this contributes to inflammation and incidences of health, mental health and chronic health kind of symptoms. Our environment has become slightly more toxic than it used to be, so we have more pollution, more toxicants that we're exposed to in our environment than in the past. And our microbiome can become dysbiotic, which we talked about in the earlier picture, and this relates into that intestinal permeability and brain permeability, which is known as a leaky gut and leaky brain. So there's lots of times where we have a greater demand for extra nutrients. And some of these are listed here, which have been documented in the Better Brain book that Julia wrote with Bonnie Kaplan. So one of the times where we may need extra nutrients is when we go through chronic stress or trauma. And we've certainly all been through additional stress and trauma in the last few years. And with natural disasters constantly occurring, these are things that place our body into greater need for nutrients through the fight or flight response. And the theory behind this is called triage theory, that the body will prioritise where nutrients go to support that fight or flight response because it's about your survival. And this may mean that some of those nutrients don't make their way to other places. There's times when people are taking medications long-term where nutrients can be blocked, so oral contraceptive pill can be one example. When we're going through times of increased demand, so pregnancy and postpartum and breastfeeding is also another time where people may need greater nutrients, and that's certainly a risk time for postpartum mental health presentations, anxiety, depression that people can experience. As we age, we may also absorb less, and so that's another time that potentially more nutrients may be needed. If we are exposed to more of these pollutants and toxicants, being on a vegan or vegetarian diet where some of the nutrients may be completely missing from somebody's diet. Many nutrients are only found in animal products or minimally available in others, or less bioavailable in plant foods. So zinc, iron and B12 are some examples there. And there also may be some genetic differences. So some people may genetically be more prone to need more nutrients to support their body's methylation processes. But more research is needed to really kind of understand what that might mean on an individual basis. And another reason for needing more nutrients is when you're ill. So that's where celiac disease can come into it. So celiac disease is associated with malabsorption as a symptom due to the damage that occurs in the GIT, or the gastrointestinal system. And this can improve for many people with a gluten-free diet and over time. But for many, the healing isn't perfect. And so even after following a gluten-free diet, there may still be psychological or neurological or other symptoms. But why? So there's a few reasons why you could still struggle even on a gluten-free diet. And I know some of the earlier talks covered some of the kind of more medical components around this, but these are some of the different options as to why you may still struggle with mental health, even on a gluten-free diet. So one study I found reported that up to 32% of food advertised as gluten-free in restaurants was actually contaminated with gluten. So it's quite a high chance of accidental glutening. Other reasons may be if you're replicating the standard Western diet with a standard sort of gluten-free diet that's lower in nutrients and potentially more inflammatory with those ultra-processed foods. There can be cross-reactivity to other foods for some people. The dysbiotic gut, so if a gut environment is still not in balance. And as touched on by Sam, that heightened sort of anxiety and stress about gluten in the environment as a threat. So constantly having to be switched on and thinking, can I eat this? Am I safe? And of course, other health conditions that may be going on, such as other autoimmune conditions that are very common, such as thyroiditis or other chronic health problems. gut health problems, and just all the usual kind of other causes of stress and mental health symptoms going on in your life, just like the average person without celiac disease. How somebody's sleeping, how they're moving their body, how they're living their relationships. And an important one is the potential for nutrient insufficiency or deficiency. So I had a look to see what deficiencies are known about for people that have celiac disease and are on a gluten-free diet. And some of the commonly found ones that were reported in this 2016 review speaks to the low fibre, certain vitamins, folate, or folic acid, vitamin C, B12, and vitamin D, and B6, and certain minerals such as magnesium and calcium and zinc and iron, especially for women who are menstruating, and can be low protein, can be high in saturated fats and more inflammatory fats, and can potentially be higher GI foods. So what can you do to improve any lingering mental health or neurological symptoms on the gluten-free diet? Well, once you've committed to that gluten-free diet and you're working on healing, which takes time, then it's looking at the quality of the nutrients in the gluten-free diet. And I'm going to run through some of the ideas on this now, including dietary modification and nutritional supplementation. So yeah, we've got your adherence to gluten-free, you're working on gut healing, optimising the gluten-free diet, and that, supplementation. So the most interesting sort of evidence-based dietary modification for mental health was researched first in 2013 by Professor Felice Jacka, and she's an Australian psychiatric epidemiological researcher, I think is her title. And that means she looks at how things can impact on mental health. And she's the author of another really good book, which is called Brain Changer, which is all around her work in this area, researching nutrition for mental health. So she ran this landmark study in 2013, and they asked the question, if I improve my diet, would my mood improve? And they included adult Australians who were all diagnosed by a health professional with major depressive disorder. And they randomised them to two groups. So one group was given the dietary intervention, which involved a modified Mediterranean diet, which I will talk more about shortly. And the other group was just in a kind of, nice support condition group. But they didn't have any dietary intervention. And it was the first study that found that when people did this for that 3-month period, 1 in 3 actually no longer met criteria for major depression. And this is with no therapy. People were allowed to be on medication in either group, so that wasn't an issue. But yeah, of those that were doing the dietary intervention, it was 1 in 3 that went into remission. And this was exciting because there hasn't been a lot of new improvements in our options for mental health treatments other than medications and therapies. And so it provided support for a new intervention that people could access outside of these, that they could just simply do themselves and do at home. Now, this diet can be easily adapted as gluten-free, and I found a study, 2023 study, where they looked at this. And so what's in a Mediterranean diet, it's really just living like they do in the Mediterranean, how we historically have eaten with just more real foods, lots of fruits and vegetables, legumes, nuts and seeds. And the gluten-free equivalent, it's the gluten-free whole cereals, lots of extra virgin olive oil as fats, moderate fish intake, dairy and eggs for those who can eat those, and red and white meats a few times a week. And what's important is probably what's not included as well, that it's really low in those ultra-processed foods, not just gluten exclusion. And it's in that context of a healthful lifestyle, having meaningful connection, eating with people where possible, regular movement, sunlight, and low alcohol. And you'll be able to check out resources from the Food and Mood Centre and the Brain Changer book around this. And so once you've optimised your diet, the next controllable factor is really looking at supportive supplementation to plug any gaps. And we are so lucky to have the leading mental health and nutrition researcher here in New Zealand, down at University of Canterbury, Professor Julia Rutledge. And she's been researching with a colleague of hers, Bonnie Kaplan, who's based in Alberta, in Canada. And they've got this new book, The Better Brain, that's really worth reading. They have been doing RCTs, or randomised control trials, which is considered the gold standard type of research for looking at outcomes. And they've been looking across all types of mental health symptoms using a multi-nutrient supplementation. And what they find is consistent improvements in mental health symptoms like stress and anxiety, ADHD and depression, as well as being able to prevent things like PTSD after natural disaster like the Christchurch earthquakes, research that they did, and a few other things that are relevant, such as premenstrual syndrome and even quitting smoking. And the research base continues to grow. And so in their research, what they do is they use a particular multi-nutrient product that is designed with a lot of micronutrients, as well as some extra ingredients like amino acids and antioxidants. And so these products are designed to be greater than what you might get in an over-the-counter product, but they've been tested for safety to be able to go through these sorts of trials. And I did check in with Julia just to ask if they'd done any studies on celiac disease yet, and she has said that they have not. But what the research does seem to show is that when people have mental health symptoms, that those nutrients being used as a package rather than a sort of single nutrient approach has got the most research support. And there's enough evidence there now that this can be considered a valid mainstream treatment, either standalone on its own or alongside other types of therapies or even medication, because nutrients have been also found to potentiate the effectiveness of certain psychiatric medications, although when using their particular medication, you do need to be monitored if you're on medication, because it may mean that you start to need less of your medication, which would be a good thing for some people. This 2019 review attempted to provide some advice on supplementation for those with celiac disease, as there was currently no consensus. And so this review went through specific nutrients and different dosages and timeframes to treat, as well as recommendations around retesting and monitoring. And the authors stated that the causes and mechanisms of deficiency is not always understood, but they did recommend that lifelong dietary supplementation personalised to the individual may be indicated. And I won't go through the different, it's quite a comprehensive review, but you'll be able to look that up. It's available online. So I also had a hunt for outcome studies that did use nutrients for celiac disease specifically, and I came across this 2009 study that looked at just 3 B vitamins as a supplement for people that had celiac disease. And so these 3 vitamins were folic acid, vitamin B12, and vitamin B6. So some of the nutrients that we know can be low, either because of being celiac or potentially on the gluten-free diet. And what they found was really interesting. They did find broad improvements in terms of psychological well-being. It was a control trial, so they had a control group that was on a placebo and the group that was taking the B vitamins, and they looked at them at their baseline and they looked at them after the 6 months, having measured various tests around anxiety and depression. And they did find that improvement overall, but it was the people who were symptomatic at baseline that actually improved the most. So that sort of speaks to the idea that if you're not symptomatic, if things are going well, you may not need to just have a supplement like this. But if you are symptomatic with some of the symptoms that can indicate that you're low, then it may be worthwhile. So that was a great study. So In addition, I guess the other thing that, can be a useful thing, given that certain nutrients are low, that you can monitor your blood levels, and this has been recommended in several of those articles that I've cited today. So there's particular nutrients that can be tested for in the blood, vitamin B12, folate, vitamin D, zinc and iron for women especially. And these are something that you can, do with your GP, but in New Zealand we also have the ability to self-test, which I'll provide information on at the end. But it is recommended to look at the reference ranges with somebody that understands them and consult with your health professional as needed to make sense of it. So what else can be done other than nutritional changes? These are 3 psychological tools that I thought I would talk about today. There's many others, but these 3 are quite key for when you're struggling with difficult symptoms, whether they're mental health symptoms or whether it's from things like physical symptoms or even something like acute gluten ingestion or navigating the terrain of a diagnosis of celiac disease itself. So psychological flexibility and self-compassion are the first 2, as well as promoting a relaxation response, which switches on that rest and digest, where we can optimally heal. So let's have a little look at psychological flexibility. This concept is a mindfulness-based approach that comes from acceptance and commitment therapy, and it involves being able to really stay in the present moment and navigate what's happening in spite of any difficult thoughts, feelings, or sensations that may be going on in your body. Being able to stay in that present moment and take a values-based action in a direction that is going to be helpful or that matters to you. So being able to flex with whatever's going on and not being bossed around by thoughts and feelings or sensations. And I often say to my clients who are chronically ill at the time that we're working on this acceptance and change. So accepting the current reality and the diagnosis while working on all the ways that your health can be improved. And I believe that improvements to health is generally always possible. So this can be learnt, and I haven't provided, I guess, a lot of depth to it because it's quite acceptance and commitment therapy is something that a therapist can teach or you can learn about through certain self-help books that are out there. But yeah, it's a very useful framework for navigating chronic situations of health and mental health. And part of the psychological flexibility is the ability to be compassionate to yourself. So Kristen Neff, who's one of the compassion-focused researchers out there, she describes self-compassion as a positive way of relating to oneself that involves self-kindness, mindfulness, and a sense of common humanity. That ability to extend out that it's not that we all suffer in some way, and this is what's going on at the time for you. And the self-compassion is really important in coping with chronic symptoms and with being able to adhere to a gluten-free diet. I found a 2017 study that actually found that the ability to have self-compassion directly impacted on the ability to adhere to a gluten-free diet and improved quality of life. And part of self-compassion is a sort of self-regulation process, so being able to self-monitor and set goals and make plans and then reflect on all of that. And doing that with a self-compassionate tone means that you're less judgmental of what's happening, perhaps more realistic with the goals that you're setting, and a little more kind to yourself through that process as you reflect on what's working and what might not be. And it was also found to be associated with less accidental and intentional gluten consumption. So Kristen Neff's website is selfcompassion.org. She has many free audios and other resources to help learn self-compassion. A third tool that's in your control, which is possibly the most foundational aspect of getting well from chronic illness and mental health, difficulties is being able to regularly switch on the relaxation response. This healing parasympathetic nervous system is where your gut can relax, that you can digest and absorb, and your body feels safe and calm and can focus on that healing. And there's many ways to do this. I missed the breathing talk earlier, but I imagine that focused on relaxation through deep diaphragmatic breathing potentially. This type of breathing slows down and extends your out-breath, and it tones up that vagus nerve, which is part of that gut-brain connection. There's many individual ways that you can feel more relaxed, and we're all slightly different in what we find relaxing. But these are some of the ideas that I often talk about with some of my clients. So developing that breathing relaxation practice to switch out of fight or flight, ensuring adequate hydration so that your body doesn't feel stressed from being underhydrated, good protein, breakfast before 10 a.m. at the latest, considering those nutritional supplements that can support the fight-flight response and support the nervous system. Caffeine isn't always your friend when it comes to fight or flight, so if you're experiencing any symptoms of anxiety or insomnia, then it may be worthwhile considering a wee break or reducing. And just structuring your meals around like protein and real food, less ultra-processed food, slowing down to eat, relaxing, having a daily movement practice. And one that I think has got worse for a lot of people, probably through the global pandemic, was creating a good wind-down routine. I'm finding more and more people tend to struggle with getting off their device at the end of the day, and that they're just scrolling, and that's pretty taxing on the nervous system. So finding a way to actually relax at night that's not just scrolling, cup of herbal tea, reading, journaling, listening to music, unhooking from your mind and any worries from the day, writing them down. And alcohol-free days, because alcohol, although it can relax in the short term, it can be a stressor. And other natural sleep aids that can help to relax. So magnesium, herbal teas like chamomile, melatonin, which can be prescribed, and an amino acid called L-theanine, which is really calming and has an evidence base around promoting relaxation as it encourages GABA, which is a calming neurotransmitter. So I did want to provide mention of having a plan for accidental glutening. This really is something that can be used for any sort of autoimmune flare-up, or it doesn't have to be just for these types of occasions, but it's designed to just help get through any kind of inflammatory activity that's going on. So a first aid plan, which you could create if you haven't already got one of these, with a health professional, going strictly gluten-free, making sure that there's no more gluten going in. The use of some anti-inflammatory agents, curcumin, fish oil, immune-supporting vitamins and minerals, like the vitamin D, vitamin A, zinc, intestinal lining aids such as glutamine. There are digestive enzymes that target gluten, can help break it down, specific probiotics such as lactobacillus rhamnosus or LGG. Certain teas can help with digestion, such as peppermint, and for some, potentially having a period of fasting, but check that that's okay for you, just letting everything kind of die down. And in addition to those steps, being able to sort of bring in that psychological flexibility and self-compassion that I mentioned earlier. This is actually a really hard thing, you know, when you're in pain and suffering, and this is, you know, come out of the blue, and you know, it's frustrating, so it's really hard, and you know what you're going to be going through and how long for, and you know, all those sort of catastrophic thoughts about what's happened. So that ability to come back to the present moment and acceptance of those emotions and that it's happened, and then thinking about what can you do to kind of soothe yourself through that. So breathing to help calm and reduce any pain, self-care through, you know, different things that you do find soothing. So for some people, maybe a heat pack, distraction, getting support. And importantly, once it's passed, it's that ability to get a sense of agency again, of, you know, evaluating what happened and how did this happen and what might I need to do differently, or what might I need from my environment to prevent it happening again. And that can help just feeling, I guess, less helpless with the situation. And I also wanted to mention intentional gluten consumption, as this is something that people can find hard to not do, especially with adjusting to that kind of diagnosis. And, you know, it is really a process potentially for some people of grief and loss, of letting go of foods that you used to enjoy, and that the changes to your whole life and the impact of that. So intentional gluten consumption can occur for many reasons. So it can be that feeling of restriction and control leading to a binge, feeling deprived of certain foods, going to certain celebrations and rituals where there's foods that it may be a high-risk situation, where it's harder to perhaps say no, nutrient insufficiency resulting in cravings to eat, so ensuring that you're eating and nourishing yourself well, getting that protein and healthy meals in throughout the day so that you're not going to have low blood sugar and be less able to kind of manage. Can be lots of these organisational difficulties planning food at home or when out and about. It involves a lot of assertiveness skills, being able to talk about, you know, your needs around what you're eating. And so it can come, you know, depending on your environment and the level of understanding that people have and support that you might have from peers in your environment and family and community. Controversial area of food addiction from food-derived opioid peptides that some brains may be susceptible to, and that can result in cravings and urges to consume these particular foods. And it comes shrouded in this shame and secrecy and fear of judgment for many people. And so I always think, you know, if this is something that you're struggling with, working with someone on those underlying reasons and establishing solutions to them, you know, is probably a good idea. So, in summary, there's many things you can do to get out of the fog if you have remaining psychological symptoms while on a gluten-free diet. Dietary changes that take you away from too many gluten-free ultra-processed foods, consideration of nutritional supplementation, potentially blood level monitoring of certain nutrients, and navigating the adjustment to a gluten-free diet in a gluten-dominant world through tools such as psychological flexibility, self-compassion, being able to support your rest and digest to be able to heal and absorb, and having a plan so that you feel a sense of agency and less helpless, and something that you can carry forward for next time. And I put together a few different resources from some of the things that I've mentioned in this talk. So the Better Brain book by Julia and Bonnie, and Brain Changer by Felice Jacka, two really great reads that cover Mediterranean diet for depression or mental health generally, as well as micronutrient use for mental health. There's some websites. There's a free course from Julia, which is really worth looking at, and some other resources there, and some other books that could be interesting extra reading. And that is the end of my talk.
Thank you very much. We've had a few questions come in that we'll just ask. Someone's asking for a bit more detail about the self-testing side of things and how you can go about that.
Yeah, so on the slide here, there's a self-testing link, which is mytests.co.nz. They do provide a lot of different information around different tests. So some of the ones that I've mentioned today that I would commonly think are interesting are things like B12, folate, vitamin D, iron for women in particular, but can be for men as well. And yeah, it's something that you can just self-order and self-fund, or you can go through your GP. And yeah, it's always wise to have somebody help interpret and understand what it means in the context of your diet, potential gaps, and any symptoms that you have, rather than a sort of blanket, you know, everyone should always test and everyone should always supplement.
Great.
Hope that answers that.
We've got another question about the study by Julia, and about whether the results are with 100% compliance, given the large number of supplements needed a day, and whether she's still seeing results with lower intake amounts.
I've talked to Julia about this. She says that, interestingly, compliance isn't too much of an issue somehow, because a lot of their research initially was done on ADHD, which, as you can imagine, is quite hard to get people to take 3 times a day, 4 capsules. But they do also offer powder options, and they do find even lower doses. So in their research, they have specific dosages for certain things, but certainly everyone's different, and not everybody needs that full dose. And she talks more about that in her book as well.
Great, thank you. And we've just got one more question as well, about whether, with issues like depression and anxiety, whether people with those issues are routinely screened for nutrient deficiencies?
No, not routinely, I often have people come to me that their GP might have suggested to get therapy, and they won't have looked at iron or B12 or anything like that. So GPs don't have much time, and I think it's complex. So it's helpful to have all these resources and growing research and helping people become more self-aware that they can look at these things, because these are the low-hanging fruit often. It's not been uncommon for me to see someone with a nutrient deficiency and they don't come back once we fix it. So it does happen. It's not always, of course, simple like that.
Thank you. That's all the questions we've got for now.
Lovely. Thanks very much.